a study of global death trends and the author's health age predictions versus 5 similar input diseases, using the viscoplastic energy model from the GH method. Math Physical Medicine No 1180, VMT Sharp 570, December 9, 2024. Category Mortality Diseases. Abstract. The author has been self-studying internal medicine and conducting medical research since 2010. Over the past 15 years, he has published more than 1,000 medical papers. Through these efforts, he has gained extensive knowledge regarding his health. The following statement highlights one of his key and serves as the theme of this paper. Obesity significantly increases the probability of developing type 2 diabetes, T2D, due to its role in promoting insulin resistance and systemic inflammation. When obesity and T2D coexist, they synergistically heighten the risk of cardiovascular disease, CVD, through metabolic and inflammatory pathways. Chronic kidney disease (CKD) is predominantly caused by T2D, as prolonged hyperglycemia leads to renal damage. These 4 conditions, obesity, T2D, CVD, and CKD, are interconnected, and their combination exacerbates systemic inflammation, hormonal imbalances, and oxidative stress, collectively increasing the risk of certain cancers, including liver, colorectal, and pancreatic cancers. Unfortunately, these types of cancers are among the most dangerous types of cancers, due to their high mortality rates and challenges in early detection and treatment. The global mortality rates for these 3 cancers are cases per 100,000 people globally in 2022: liver cancer, 7.4; colorectal cancer, 5.3; pancreatic cancer, 4.5 to 5.0. This study consists of 2 parts. The first part focuses on global public health. The author selected global annual death numbers as the output strain and used 5 prevalence rates: obesity, type 2 diabetes, T2D, cardiovascular disease, CVD, chronic kidney disease, CKD, and cancers as its input stresses. For comparison, he also analyzed his personal health data, using his health age, a modified biological age, reflecting his overall metabolic conditions as the output strain. This output was influenced by his 5 input stresses: body weights, glucose levels, and 3 risk probabilities of developing CVD, CKD, and cancers. Summary of findings. 1. Correlations are between 1 output and 5 inputs: obesity, T2D, CVD, CKD, cancers. Worldwide case: 98%, 99%, 100%, 100%, 100%. GH personal case: 84%, 87%, 94%, 90%, 88%. All 10 correlations are very high, exceeding 84%. The correlations for the worldwide case are notably higher than those for the author's personal case. 2. VMT energy contribution ratios: worldwide case: 31%, 20%, 20%, 19%, 11%. GH personal case: 25%, 27%, 16%, 21%, 11%. For worldwide case: obesity, T2D, CVD, CKD, cancers. For GH personal case: T2D, obesity, CKD, CVD, cancers. The ranking orders differ between the global case and the GH personal case. Global case results are based on actual disease prevalence percentages worldwide over past 11 years, while the GH case reflects the author's personal health history over past 15 years. Overweight control is challenging but achievable. Diabetes, on the other hand, can be managed, but is nearly impossible to completely eliminate, achieving a diabetes-free state. Additionally, the author's CKD history from 2009 to 2011 is more recent than his CVD history from 1994 to 2005, which influences the energy ranking of his personal diseases. These factors explain why his energy rankings differ slightly from the global case, which reflects an averaged perspective of the worldwide population. Key messages. Overall, the author's health trends and patterns align closely with global trends, illustrating that accurate biomedical and health knowledge can be effectively applied at both the global and individual levels. Body weight control serves as a critical foundation. directly influencing glucose regulation. Once weight and glucose levels are well managed, the likelihood of other mortality-related diseases decreases accordingly. Although the degree of risk reduction varies across different disease conditions, one notable observation is that global data trends are moving upward, indicating worsening conditions, while the author's data trends are moving downward, indicating improvement.